Well, I'm rather scared of this giant audience. I was expecting a very small crowd. I've not been invited before. Thank you very much for inviting me. It's a pleasure to be here. And what I'm going to talk about is healthy skin, really from infancy right through to old age. And given that there are 3,000 different skin diseases, I think you'll be very pleased to hear I'm only going to talk about 3 areas. So now, I thought I'd start with a very basic slide here. If I were to ask a 5-year-old why they have skin, and I have, so I know what they say, it's actually maybe a question you've never really asked yourself. But skin is an extremely important organ. In fact, it's the largest organ in the body. You probably know that. And if we didn't have skin, we would not look human. So it makes us look human. And that's really very important when it comes to what's in the column there on your right, advertising the individual, because that's what your skin does. But from the point of view of function, the skin is an extremely important barrier to environmental injury. So the integrity of the skin is very important for you as an individual. It blocks physical injury, and it also blocks injury from invisible agents such as ultraviolet radiation. We'll talk about that a little bit more later on. But also, the 5-year-old would tell me that your skin keeps your insides in, and your skin keeps things outside out. And that would be spot on. Because actually, once again, perhaps you don't think about this very much, but you know all this stuff about finding water on Mars. Well, actually, human beings are full of water. And if you take a 70-kilogram individual, they are 2/3 made up of water. So can you imagine if you had a leaky skin, what would happen? All that water would leak out. And actually, in some very severe diseases, that's precisely what happens. And so if you get skin failure, just like kidney failure, heart failure, you can die. So don't underestimate your skin and the importance of having a normally functioning skin. So protection of the underlying structures, absolutely. But also temperature control. You sweat, you lose temperature. If you can't sweat, you die of heat exhaustion. So again, the ability to sweat and cool down the body is very important. I don't have time to go into all the complicated endocrine effects that your skin has, but it's a really complicated organ which can do all sorts of things. And it's highly complex from an immunological point of view as well. Back to the individual. Well, you recognize your friends because you're recognizing the features of their skin. You make a judgment about attractiveness. You also make a split-second judgment about, are they healthy or are they falling apart, because you've judged them instantly in a split second on the basis of what they look like. Communication with facial expressions. And then sexual functions such as pheromone production. We've sort of forgotten about that, haven't we, with deodorants? But actually, it's there in a kind of subliminal way. You judge sexual maturity. And then here's the real bugbear, emanating from America mainly, the quest for eternal youth, because human beings love youthfulness. And we won't even mention Jimmy Savile. Now, I was on holidays in Mexico. These are 2 lovers. They're known as the Mayan lovers. And all you can say about them is there's a female and a male. And one is smaller than the other. And you know from their skeletons, they're male and female. But apart from the fact that they're very tall, which was perhaps unusual for some races of the day, that's all you know about them. You need more to be able to make a judgment about what they were like as individuals. So, if you have lovely healthy skin, you can actually portray that so easily. And everybody knows Kate and William. You look at them, they're youthful, they look as healthy as can be. And that again is all down to just the look of them, which is their skin. Not such an easy photograph here in the gloom, but this poor little child, look at the condition of his skin. It's all peeling. You can see that he's swollen and he's got this horrid condition, which you see in starvation in Africa. It's called kwashiorkor, where that child does not get enough protein and the skin falls apart. It even stops being able to produce melanin, which requires, melanin is the pigment of the skin, and that requires protein for it to be produced effectively. And then look at this poor, unfortunate man with leprosy. You take one glance at that skin and you think horror, because again, the human brain makes split-second decisions on how people look and judges them. Now, if you think of your reaction to my rather horrible photographs here, you probably have a mixture of horror and sympathy. And actually, if you just think of your reactions, that's why patients who have visible skin diseases feel terrible about themselves, because they are waiting for everyone they meet to make split-second decisions about them as non-healthy human beings. So now, after that introduction, I'm going to talk about three main areas. First of all, eczema. Secondly, acne. And finally, the aging effects of ultraviolet radiation and skin cancers. We talked about the skin being very important from the point of view of maintaining a barrier between the internal body and the outside world. And there are very numerous skin diseases which actually impair this barrier function. Probably the commonest is eczema, which, believe it or not, affects 20% of children in the UK and Ireland. So it's an incredibly common disease. Now, of course, it ranges in severity not to being mild enough, but also sometimes horribly severe. It comes about because the skin is too dry and it has lost its barrier function, so it actually allows too much water to be lost. And when the skin is dry and flaky, it feels very itchy. This leads to scratching, and then the scratched, damaged skin allows bacteria, sometimes viruses, fungal infections, all to proliferate. And then, of course, the individual who has this sort of skin problem uses multiple things to try to correct the problem. And the more you are exposed to multiple agents rubbed on the skin, the more likely ultimately you would be to develop allergies. So infantile eczema causes havoc. There's another little baby. Both of you can see the red blotchy all over the body. If you felt that skin, it would feel very rough. And the poor little baby is in constant motion, trying to scratch because it feels so terribly itchy. Now, infantile eczema, so-called atopic eczema, is a genetically influenced disorder and often linked within the family to asthma, hay fever, and urticaria. People call it hives. And the problem is, because it's such an itchy disorder, the baby doesn't sleep. And if the baby doesn't sleep and is howling all night, nobody sleeps. So it causes havoc in a family. And it comes about, we now know, for the most part, because the skin is too dry. I've mentioned that already. Why is the skin too dry? A number of years ago, a gene called filaggrin was found to be very connected with this particular dry skin scenario. And there is a genetically inherited condition called ichthyosis vulgaris, which means common scaly skin like a fish. That's the literal translation of that, but it's a genetically inherited condition of very, very dry skin linked to mutations in this gene. And here you can see the black staining is where you have normal expression of filaggrin, which is hugely expressed in the outer part of the skin, the stratum corneum. And where there's no filaggrin, you get no black staining. And if there's no filaggrin, the outer part of the skin loses all its normal elastic cohesive properties, and the stratum corneum becomes leaky, and it doesn't do its job defending the individual. And that leads to eczema, but also mutations in the gene are now linked with asthma, peanut allergy as well. So it's a gene, changes in which can cause quite a lot of different disorders. Now, it doesn't account for 100% of cases of eczema, but it accounts for a goodly number of them. And one of the dermatologists in Our Lady's Hospital in Crumlin, Alan Irvine, together with Erwin McLean in Dundee, were responsible for making these links between ichthyosis vulgaris and the mutations in filaggrin, and Erwin McLean has gone on to show a lot of these other associations. So a lot of that research was gathered here in Ireland. So how do you stop an individual developing atopic eczema? Well, the first thing is to know about the problem, that dry skin can be very itchy. Often there will be a family history of individuals with sensitive dry skin. Well, what's sensitive skin? Well, you put on a woolly jumper and you feel all itchy and scratchy. That's sensitive skin. Or you take a shower and once you get out from the shower, your skin feels tight and dry. Or you go for a run and when you're sweating, you feel itchy. So all of those would be features of an itchy, sensitive, dry skin. And then on top of that, you can get allergic reactions, and also you get irritant reactions. And what would be the commonest cause of irritant reactions? Well, actually, your shower gel. Your shower gel. My mum is nearly 90, and I was talking to her on the phone the other night, and I said, "Mum, what did your granny do to wash her skin?" And she laughed for a moment. And then she said, "Oh, well now, your grandmother actually had a bathroom." And I said, "Mum, was that very uncommon?" "It certainly was," she said, "because down the road, other people had to go to the pump." So now, think about it. There was my privileged great-grandmother with her bathroom. That was highly unusual in those days. But the local people had to go out from their houses, go to the pump, fill buckets of water, heat them up in order to wash themselves. How many baths a day do you think they had? Now that's 2 generations ago. My great-grandmother's day, people had a great deal of trouble getting hot water. It was very expensive and it was highly troublesome. So my mother said bath day was a kind of major event in the calendar. It was every couple of months. It was certainly not twice a day like what we do now. Now you think about that, and you think, what are we doing these days? Well, the shower gel twice a day, it desiccates your skin. And what about those who wash their hair with shampoo in the shower as well? Twice as bad. So if you have dry, sensitive skin, and you're doing that, you're giving yourself eczema. Greasy things are great. My great-grandmother, if she had dry, itchy skin, do you know what she would have used? Goose grease. Goose grease. That's what they had. Nowadays, we've got much nicer things. We have soap-free washing agents which have no bubbles and which are very kind to the skin. So I'm not saying don't wash. Wash, but be careful what you wash with. Moisturizers after your shower will trap water in the skin and keep the skin from drying out. And we have a whole bunch of things. They're really inexpensive, over-the-counter, just oily things ranging from liquid paraffin mixed with white soft paraffin, which looks like runny Vaseline. Great stuff if you have terribly dry skin. very inexpensive, emulsifying ointment, and then things like Silcox Base Aqueous Cream, down to lotions. Paraffin gel, no preservatives, because it's purely inert stuff, never causes allergies. The more water you add, and in creams and ointments, and in creams and lotions, I should say, water is added, and then preservatives are added, and so people can react to those things. Although mostly they're added in very low levels, so you don't have too much risk from the products that you buy. Now, you're probably all asleep, so I'm going to find out if you know what this is. This is eczema. Can you see it? It's the thumb, the index finger, and the middle finger. And you can see the skin is all peeling and would be dreadfully itchy. It's on the left hand. It's the fingertips only. It's a right-handed person. I'm going to give €1 to the person who tells me what caused it.
Circulation. Handshake.
Oh.
Washing powder.
You see, my job is terribly exciting. I have to be a detective. I have to know what people actually do, and patterns help me greatly. So, who chops garlic? Well, all sorts of people. Cooks, housewives, maybe some men love chopping garlic. And when you look for allergies, you look for the site of maximum contact, and you look for exposure. So it's not the person who's done it for the first time. It's the really enthusiastic cook. So exposure determines it. And we actually diagnose people because we're not always that clever. We sometimes have to really take a good history and then use a standard series of allergens and test them. And then we can say for sure what is the cause. And then, of course, straightforward, isn't it? The treatment is avoid the cause. That was a very quick gallop through eczema. Now we're going to talk very briefly about teenagers. So, just about growing up, you have your lovely little baby, they turn into children, and then they reach the age of 8 approximately, and that's the age that your adrenal glands wake up. And observant mothers often notice things like age 8 going on 9, their little darling has blackheads in the ears. That usually happens around the age of 8. And then puberty in boys is usually somewhere after 11, and in girls anywhere after 10, but usually around 11. But in America, it's getting earlier, and it's now a year earlier than it used to be, and they're very interested in what might be the cause. And it actually might be obesity. It might be, but it's not 100% sure. But puberty is occurring earlier rather than later with increasing affluence. And puberty leads to male hormone production, both in women and men. And that's what androgens are, male hormones. And with androgen production, the oily glands in the skin wake up and they produce oil, whiteheads, and blackheads. And therein lies all the problems, because people don't like oily skin and people don't like whiteheads and blackheads. And if you have very oily glands, they are big glands and they can get colonized by bacteria, and then that leads to acne spots. So, of course, to have an oily skin in the teenage years is completely normal. How much it happens is genetically determined. So if you have oily parents, you'll have oily children in their teens. Sorry, but that's just the way it is. And it's rather dismaying to children to be able to say to them, well, actually, sorry, but you're going to wind up rather like your parents. They get awfully upset when I say that. But it does help you to know what's likely to happen to them, because if you have parents with dreadful acne going on into the 30s and 40s, well, that's not a great family history to have for a kid who's age 18 and bothered about their acne and asking me, when is my acne going to go away? The family history can be a guide. It's not absolute, it can be a guide. So to prevent children getting acne, well, don't put oily products on an already oily skin. Avoid garments which induce sweating. So, for example, cycling helmets on an oily forehead prone to acne will make acne worse. And then sweating conditions like going in saunas or maybe going off to the tropics where the person sweats greatly, that can make acne worse as well. So if active treatment is required, and in almost all teenagers, they do get spots. But thankfully, many of them just get mild spots, and you can use some very basic treatments like this chemical, which is as cheap as dirt and works awfully well for most people. It's called benzoyl peroxide, and you don't even need to see a doctor. It's over the counter. Your pharmacist would give it to you. And that often deals very nicely with very low-level teenage acne. Or the GP might need to give a topical antibiotic if it wasn't quite good enough. Well, for those who have more severe acne, antibiotics given for about 6 months would be the next way of dealing with it. And we choose antibiotics which, generally speaking, aren't used for anything else. And really, the side effects of taking a 6-month course of any of these, by and large, would be pretty much minimal. Some women and some girls have upset periods and acne flaring at the time of the periods, and often in that situation we give an anti-androgen mixed with estrogen, and it's an anti-acne drug, but it's also a contraceptive. So that would be for an older teenager, it wouldn't be for a 12-year-old. But then sometimes all of these things fail, and we have to think about stronger treatment. And we have a drug called isotretinoin, which is a vitamin A related drug. It's given on a dose which is dependent on body weight. The course is determined by the severity of the acne, usually 4 months. More severe cases might need a little bit longer. And the awful thing about this drug is that it is what we call teratogenic. So if the female became pregnant on this drug, it damages the fetus. So that's my big worry with this drug, because if you have females who have to take it, they need 2 forms of contraception. And in this day and age, how can you possibly make value judgments about who is going to get pregnant? So I make no judgments about any of my female patients. Even if they're nuns, I still say to them, you need 2 forms of contraception. And actually, some of them are rather pleased. What do you make of that? So anyway, you may or may not be aware that there has been controversy about the use of this particular drug, isotretinoin, for acne. And so it's useful that in the last couple of years, an enormous study came out of Sweden. And this study was a study of more than 6,000 kids who had acne. And the Swedes, they have a very good drug register and a very good register of diseases. So they were able to gather all these kids, and they had a good register of psychiatric illness as well. So they had a comprehensive database. And they were able to look at the incidence of depression and suicide before treatment with this drug, during treatment with the drug, and after treatment with the drug. And they came up with a very significant finding, which has been suspected and found in other studies previously, but confirmed by this study. And that is that the risk of suicide is considerably greater in teenagers with acne before they are ever treated than the general population. So kids with acne are very upset kids. The risk of suicide during their treatment was still raised. But if you were treated, your likelihood of trying to commit suicide, if you've had a prior suicide attempt, diminished. And then they looked after the treatment was completed, and the risk of suicide was still there. And so, what it's telling me as a dermatologist is beware of the teenager who has nasty acne, because those are very upset people. Take them very seriously and assess them before, during, and after their treatment, because they may need considerable more help than I as a dermatologist can give them. And we chat them through all this area before we treat them, during the treatment, and after the treatment. The Swedes could not blame the drug. The evidence pointed more to the acne. So make of that what you will. So now, part 3 of this talk is to talk a little bit about sun exposure. And you all know about the sun. It's lovely and warm. We love it, the blue skies. We love the fact that our summers give us relief from the darkness of winter. But unfortunately, sunlight is not all happiness, because the ultraviolet part of the spectrum, which is the wavelengths shorter than the visible, cause sunburn, tanning, make your moles worse, give you sun allergies, make you more prone to getting infections, decrease your immune system, cause skin cancer, deplete you of folic acid, make you look old, and you heard about the eyes. I won't say any more about the eyes. The only good things about the sun: ultraviolet B shines on your skin and can create vitamin D formation in the skin. As a dermatologist, I use ultraviolet radiation to get certain skin diseases better. The Greeks 2,000 years ago did it, and they called it heliotherapy. Helios is the sun. So it's nothing new. To have some degree of suppression of your immune system from the sun is normal. And if it doesn't happen, you get a reaction to the sun, which is a sun allergy. So to have a normal degrading of your immune system does happen. And of course, we love warmth and we love the feeling of being alive on a sunny day. Very quick talk about how skin functions. Now, that's the epidermis, the dermis, and the outer part of your skin that we've been talking about, the stratum corneum, the barrier between you and the outside world. And that's a biopsy through the heel, your heel. Look how thick it is. Hands up anyone who ever got sunburn on their heels. You'd be a phenomenon, because it doesn't happen. Eyelids. The skin is much, much thinner, and people can get horrible sunburn on the eyelids. So it's not all about the color of the skin, it's about the thickness of the skin as well. Now here's a cartoon of the sun, rays of the sun, the ultraviolet rays, UVB, coming through into the epidermis. And in your epidermis you have basal cells, they're the ones on the base, and then you have pigment cells, they're melanocytes. And your melanocytes function like an umbrella. They have little extensions that squirt melanin, like a parasol, over the nuclei of the basal cells. And so that's the function of the melanocyte, to protect the skin against invading ultraviolet. But if it misses and the UV gets in there, it can damage that cell. And that's sunburn, poor little fellow with his blisters, redhead, horrible sunburn. And who gets sunburn? Well, actually, a very famous dermatologist in the US, Thomas Fitzpatrick, Irishman by origin, and wrote the big American textbook, divided different colors of skin into 6 types. And Fitzpatrick type 1 is like that little fellow there I just showed you, always burns, never tans. That's your Irish redhead. Skin type 2 burns easily, tans poorly. That's the vast number of Irish. Okay? 70% of the Irish are skin types 1 and 2. Skin type 3 would be your Anglo-Saxon. You know that sallow complexioned person that we all envy because they get the good tan? That's skin type 3. They tan well and they only rarely burn. It takes a lot of ultraviolet to burn them. Skin type 4 would be your Portuguese mahogany brown type that you see on your holidays. They're always tanned and they very, very rarely burn. Skin type 5, Asian. Skin type 6, black skin. Now, I think I'm going to give €1 for the person who can tell me what this is. Apart from showing you the skin types 1 to 6. Ooh, you're as old as I am. My son gave me this. But it's a good illustration of the redhead, skin type 2, skin type 3, the wall, skin type 4, 5, and 6. So I wonder, did they know about Fitzpatrick's skin types? I wonder. So when ultraviolet comes into your skin, do you remember my cartoon of the basal cell? And it strikes DNA, which is this helical molecule here. It actually strikes these molecules, and when they absorb ultraviolet radiation, they're ring structures which absorb the energy very well, but it makes them link. These cross-links occur. And if you can see here, this cross-linking means that when the DNA unzips, if that mistake is not corrected, the DNA will replicate with a fault. So there's only 2 ways that the damage from ultraviolet radiation can actually be repaired. One is by cell suicide. Cell suicide. So the cell that has the damage volunteers to commit suicide. And that's what's called apoptosis. It's an error-free mechanism which eradicates the damage done by DNA. And if those cells are not voluntarily killed off by cell suicide, it leads to mutated cells aggregating in patches and finally leads on to some skin cancers I'll show you in just a few minutes. And the only other way of getting rid of that damage which can occur is by a highly complex system of DNA repair, which involves the cooperation of all these different enzymes. Each one of those different letters is an enzyme coming together to cooperate. So you can imagine how complex that is. And that was only half of it. Here's the other half. And finally, the DNA is zipped up and put back together again in 2 straight lines, and another enzyme called helicase puts it back into the double helix that it's meant to be in. So can you imagine how complicated that is? When you've had your sunburn and your DNA damage, and that enzyme system has to go into action every time you go out and get too much sun. It makes mistakes, and some of those mistakes are retained in the skin, and that ultimately, after sunburn, leads to skin cancer. You see, she did wear her glasses, in fairness. I'm going to make one more comment about ultraviolet radiation, and that is that the dose that burns you is higher than the dose that tans you. And this is the short wavelengths of ultraviolet, UVB, and the doses are very close together. But if you plot them out in the longer waves, UVA, the doses between tanning and burning diverge. And that's got great commercial potential because the sunbed people copped on to the fact that you could tan people without burning them with UVA. UVA goes much deeper into the skin. It activates the melanocytes. And when you use UVA, you can see the little brown patches coming in here. There's an immediate tanning and a delayed tanning which occurs. People like it. People love it. There is vast amounts of money to be made out of a UVA tanning machine. They're all over Ireland. They're ghastly. They're ghastly. I'm a dermatologist. You know, this is a source of totally avoidable ultraviolet radiation, which nobody needs. People want it. What's the sting in the tail? Well, the sting in the tail is that UVA also damages the cells just like UVB, causes those photoproducts I showed you, and is a carcinogen. It is a carcinogen. And those who use sunbeds under the age of 35 increase their risk of malignant melanoma by 75%. Now, that's a huge percentage. It's a huge percentage. It's completely avoidable. If you want a tan, spray it on. Don't go on those awful devices. The second thing about a sunbed tan is this. UVB leads to thickening of the skin. Remember, I mentioned skin thickness as being important in protection. And a UVB tan thickens the outer part of the skin, the stratum corneum. It's 3 times more protective compared with a UVA tan. And people go on the sunbed to get their base before holidays. But then they go on holidays and they fry in the sun because they think they're protected, but they're not half as protected for the level of colour that they have as they expect. So it's a much less protective tan compared with the tan, which increases up the stratum corneum as well. Now, the other thing about ultraviolet radiation, and it's not just UVB, it's UVA as well, all ultraviolet radiation has acute effects on immune function. And I'm sorry if this is getting a bit technical, but we've got these wonderful little policemen in our skin called Langerhans cells. Langerhans cells have little extensions on them, and they are the policemen of the skin who rush around the place finding things that shouldn't be there. Cancer cells, viruses, or garlic. So they find things, show whatever it is to the immune system, and the immune system polices the skin. And if you go in the sun, your immune system downgrades, and you all know that too much sun and you get cold sores. So you make yourself more prone to viral infections, and the cold sore is a very obvious one. And that's just showing that there's normal Langerhans cells, and if you give ultraviolet B, it doesn't matter how you give it, in high, short doses or lower, long doses. If the dose is the same, you deplete your Langerhans cells. And here's a patient of mine having her allergy tests done. You can see the patches where we had put them on, and went off and got sunburned, ruined the test, because actually she had irradiated herself with ultraviolet radiation, and that decreases your reactivity, so it was all a waste of time. Now, this is, again, perhaps a little bit technical, but I think it's an interesting thing to tell you about, because there is a very, very common rash, which is called polymorphic light eruption. 20% of Irish people get it. It's itchy bumps that you get when you go out in the sun, especially if you take a lot of sun, usually about day 3 on holidays. And you can see here, this person has it on the back, not where they're covered up, but just on the sun-exposed areas. And I did a study with an Italian colleague of mine some years ago, and what we found was that individuals who get this rash actually have a lower tendency to get skin cancer. Now, how could that be? Well, actually, the actual science behind it was that people who get this have ultraviolet radiation resistant Langerhans cells. And I was showing you those Langerhans cells, the little policemen of the skin. When the sun shines on your skin, they vanish from the skin. But in people who get this condition, they don't. And so they're there to clean up any horrible little antigenic cancer cells that might be there. They show them to the immune system, and they're taken away. So if you are lucky enough to get polymorphic light eruption, well, you'll be much less likely in your old age to get skin cancer. Isn't that a happy thought? So UV-induced immune suppression is normal, and it does prevent people from developing photodermatoses. Failure of it, as I just said, leads to sun allergies. Well, what's the dose that you need to get immune suppression? And this, of course, is very important if you don't want to get cold sores. The dose for immune suppression is half that of the sunburn dose. So you have to be really, really well protected to avoid getting the immune suppression that might give you a cold sore. So now I'm going to very briefly show you some pictures of people who've had a lot of sun on their skin, the features of photoaging. And then we'll talk about pre-malignant and malignant lesions. And photoaging, you all know about this really, don't you? It's just pigment change, fine wrinkling, and coarse wrinkling. Smoking makes this worse. Smoking gives you wrinkles, so don't go in the sun and smoke. That's a terrible idea. Avoid the sun and don't smoke. UV also gives you dyspigmentation, and there's a youthful face, but actually if you shine ultraviolet radiation on it, you can see even in the young, ultraviolet radiation has led to considerable dyspigmentation. They do this to you in Brown Thomas to scare you into buying their products. Atrophy and purpura are caused by sun exposure, and you could see all of this. Actually, it's the sun. You can even get scarring and all of this change purely from sun exposure. It's not just the Celts who age, but black people age as well. You can see this lady, although she's got a relatively smooth-looking skin without the pigmentary change, she's got a lot of deep furrows as well. Same here. So, yeah, everyone ages. But we age differently. Here's a Chinese lady. She's got very fine complexion, but she's aging all right, isn't she? And what about this lady, who's a 95-year-old? And you know what? In China, they buy rhinoceros horns to take away skin diseases. And I thought to myself, sure, they could grow their own. That's a very bad joke. I'm being... But anyway, that's caused by the sun. And you can see the lady is aging. She's entitled to, she's 95. In Ireland, we get huge numbers of these things. And what they are scaly patches caused by sun exposure. And people don't know what they are, but they feel them on the skin. So here you have skin type 1, very fair-skinned Celt. And you can see lots of little red, scaly patches. See them? They're pre-malignant patches. They're called solar keratoses. They're highly treatable, and if you can prevent a person like that taking more sun on the skin, you'll prevent them getting skin cancer. And here's another scaly patch on the lip, just beginning to break down, a really nasty solar keratoses. So once you see these, you know that person has had enough sun on the skin to get skin cancer. And so you really want to intervene with the hat, the sunblock, change the behavior. Now, the commonest skin cancer we see, you remember those basal cells we were talking about, the base of the skin, are basal cell carcinomas. They are more common than the next one I'm going to show you by 3 times. Fair skin, 12% of men age 70 have them. So we're talking really common. We're talking really common. People who get sunburned at a young age, there is a genetic predisposition. So often in a family you'll hear, oh yes, mum had one or dad had one. Much worse in those on drugs that suppress the immune system, and they're caused by a mutation in a particular gene. Squamous cell carcinomas, that's what they look like under the microscope. Again, the risk factor, UV exposure, mostly fair skin types, 1 and 2, much commoner in males than females. Why is that? Why more in males than females? They're outdoors more. They're outdoors more. Their hair is shorter. They go bald. Different hairstyles. It's all very logical, actually. So the hair receding, and then you get one on the forehead. Outdoor occupation, of course. Ultraviolet radiation, excessive amounts can cause these, so we try not to give excessive amounts. Drugs that suppress your immune system, and human papillomavirus, certain viral types in those on immunosuppressants make it all that bit worse. And then the one you all know about, malignant melanoma, which is the cancer of the pigment cells. Everybody has moles, but you shouldn't have a mole which is changing size, shape, and colour. And the mole should be small. It shouldn't be more than 6 millimetres. And here you can see a very big irregular one growing out with extensions, different levels of pigmentation, totally different colours within it, and looking at an odd shape. Whereas normal moles are nice, neat little things which look pretty much the same all the way through. The risk factors for malignant melanoma: sunburn in young life, and the sunbeds, fair skin types, this time more common in females than males, living in sunny countries, multiple moles, freckles, family history, immune suppression, sunbed use, and excessive amounts of ultraviolet radiation, maybe for skin disease treatments, all risk factors. Early detection of all of these means you're cured. You're cured. So there's the happy thing about skin cancers. They are utterly curable by early detection. That's just one further risk factor. If this is albinism, where the skin can't make pigment, and it doesn't matter what the racial type, even in Africa, black people with this get skin cancers because they can't protect themselves by pigmentation. Now, you're all going to be examining yourselves as you leave the room. Not everything brown is bad, by no means. These are completely harmless things. They're called lentigo senilis, or solar lentigo, and they're just slightly flat brown, evenly coloured, scaly, sometimes patches, which are caused just by sun exposure, but they are not pre-malignant. So we've had a bit of a gallop through the effects of ultraviolet radiation on human skin, both UVB and UVA, and the fact that all of these things are entirely preventable by avoidance of too much ultraviolet radiation. Does that mean you need to have a horrible life? Does that mean you can do nothing? Not at all. Here's me on holidays. That's me. This is Madagascar, and we went in this thing which is called a native pirogue. It's a boat made out of the bark, about the trunk of a tree. They hollow out the middle, and then they put tourists in it. Halfway down, my husband said, "I think we're Egypts." But we did survive 4 days in very tropical conditions. But look, everyone's wearing a hat, everyone has long sleeves, everyone's in long trousers. So you can do what you like if you do it wisely. Nobody got sunburn. And here's the Namibian desert. That's me again. The tree didn't like it very much there because there was no water. It's incredibly sunny and there's incredible reflection. You can go anywhere if you dress appropriately for the climatic conditions. It doesn't mean you have to have a horrible life. You can play your golf, you can do anything, just be dressed appropriately. And then you won't get skin cancer and you'll have a wonderful life. So is it all negatives? Not at all. Here's how you stop getting skin cancer. Protect yourself from the sun. Okay? Umbrellas, clothing, and sunscreens, but actually they come a rather poor third. They come a rather poor third. They're too expensive, and people put them on very badly. 1 small glass of red wine keeps you healthy. Lots don't. 1 does. And you heard about the eyes and the oily fish. Well, oily fish is very protective. So staying nice and slim, your 1 glass of wine, protecting yourself from the sun, and lots of your oily fish, and that's all very good for you. And you get your vitamin D from the oily fish. You don't need the sun. So your lifestyle is very important in the prevention of skin cancer. It should be lifelong. Have a balanced diet, don't be fat, exercise, minimal alcohol, and don't smoke. And then you'll have healthy skin from youth until old age. He's 108, she's 104, and they're still smiling, and they haven't got any skin cancers. So we have had a very, very rapid gallop through how to stop dry skin turning into eczema, how to maintain oily skin free of acne by avoiding oily products. And then you're thinking in terms of minding yourself from the sun by appropriate clothing, your brimmed hat and your sunscreen. So thank you very much for your attention. I don't think I've ever given a lecture where actually I haven't been asked a question that was a very good question that made me think a bit more about what I take for granted sometimes. So I think it's thought-provoking.
Well, I'm on the mailing list for the Royal College of Surgeons, and this is my third year to attend these MiniMed series. They're very, very informative, and it's just a pleasure to listen to such educated people about the practical ways to preserve your life and to enjoy your life as long as you can.
This is for people who actually know nothing. They just come and learn a bit about their bodies. You know, and that you probably get to the people that way, because the College of Surgeons would be up here to a lot of people, a lot of working class people probably never there wouldn't come in the door, but if you could get them in, it'd be great. But just explain to them it's open to everyone.
I used to look after my mother, and I always had an interest in medicine even when I was a kid, because I was a very young carer for my father. In Blanchardstown Hospital, one of the doctors said to me, "You have a great interest in medicine. Why don't you go to the College of Surgeons? They're running courses in it. It's called MiniMed School." And a light bulb came on. I said, wow. So I went about it and I got a place here, and I've never looked back since.
Well, recently I attended a programme a few years ago and I found it very interesting. Helped gain an understanding and insight to medicine at a very accessible level. And I said, come back just to get a top up, and there's a few new topics in this programme which are of interest to me.
We have a house down in Spain. We've been going there for the last 12 years. And now, next time I go down, I'm a great mob of hair. I'm going to wear a hat. After the cancer scare, they just gave me a bit of wearing a hat, because I thought a head of hair would cover you from the sun. And I never wore a hat. If I'm going to go down the next time, I will wear a hat from now on. So I've got something out of it this evening, definitely.
I attended the lectures last year and I enjoyed them so much, and they were so informative. I'm here generally. I'm interested in the skin cancer, and because I've lived abroad, I've been in a hot country for many years, so I'm very interested in that particular one, and I was listening tonight and I enjoyed it very much, and it was very informative.
Knowledge is power. If you know about a thing, you can behave in a very appropriate manner, and the more people know, the more they are able to help themselves and take personal responsibility. So I think people should have lots of knowledge about themselves, about their skin, and how to prevent things going wrong. Then we'd have very much fewer problems, because an awful lot of things are preventable.
If the topic was of interest to them, because there are such a broad spec of topics, I would say certainly why not. It's free, it's very informative, and you can ask all the questions you like in the given time after the lectures. So you're not losing anything, and it's not costing you anything. So, and you can gain a bit of experience out of it.
Correct.
Definitely I'd recommend it.
First of all, it gives access to one of Ireland's most historic buildings. That's the first thing. Second thing is it gives access to leading clinicians and academics and hearing them speak. Also brings one back to one's student days in many ways, without exams.
I would recommend it because I think we all need to know a little bit more about we don't need to become over concerned about our health, but we need to be informed, so that if something is the matter, we can actually take the correct, we can alert somebody about it. Otherwise we stay passive and we say nothing, and the years will go on. So we need to actually know a little bit more about our health and what we can do to keep healthy.
Definitely, I highly recommend the youngest even to come along, and as they say, don't knock it till you try it.